just to spotlight on what's happening in Sudan, the updates and the crisis, the unfolding crisis in Sudan, including the healthcare situation in Sudan. And we have got speakers from here in the UK. We got Dr. Ahmed Al-Laisi, the President of Sudan Doctor Union, UK branch. And also we got Dr. Ahmed Abbas, who will join us shortly. He is the spokesman of the preliminary Sudan Doctor Trade Union Committee. And also we got Dr. Mohammed Nugud. He joined us from Sudan. And hopefully the internet connection will continue to be as good as possible. And following that, we got Dr. Mayada Abu Afan. She will talk to us about the evacuees, those who arrived in the UK and their situation here, and what we can do to help them, beside other things. And finally, Dr. Haitham Mohammed Ibrahim, who will, he is the Minister of Health in Sudan currently. And we are going to start with Dr. Al-Laisi.
I would like to thank you all for attending this press conference today, and I appreciate your interest and making time to attend this event. Sudan has been in a state of war for the past 5 weeks, causing immense damage to the country and its people. The health situation in Sudan is dire, with limited access to healthcare facilities due to ongoing war. The ongoing conflict have resulted in displacement of thousands of people, making it difficult for them to access basic healthcare services. There are shortages of clean drinking water, electricity, and basic requirements. There has been report of rape incident taking place in Khartoum and other cities, with victims identifying soldiers belonging to the rapid support forces. The use of rape as a tool of war has devastating consequences for the victims, who often suffer from physical injuries, unwanted pregnancies, and sexually transmitted diseases, and psychological. Sudan Doctor Union UK branch has been involved in supporting fundraising and contributing to hospital in the center and peripheral hospital in Khartoum. We have also been coordinating provision of some health services at the borders with Egypt. Support also has been extended to cities where there are a large number of displacement of people. We have been a front line in collaborating with different Sudanese medical societies around the globe and the preliminary Sudan Doctor Union in Sudan to provide some essential services in Khartoum and affected area. As the SDU-UK, we have been leading diplomatic efforts. We have contacted the United Nations, Security Council, Prime Minister, MPs, Minister of Foreign Affairs, Medical Association, Human Rights, and the NHS leaders. We have organized several demonstrations to denounce the war in collaboration with different Sudanese groups in the United Kingdom. We have written and engaged with different bodies in Sudan to ensure that to stop the war has a loud voice and presence. Also, we have organized different activities to doctors and their families and people who were evacuated from Sudan through emergency evacuation plans organized by the British government. These activities and events were aimed at supporting them, including psychological support and helping doctors to familiarize themselves with the British system and the process to get involved professionally and socially. We call upon the international community for urgent support to address changes faced by the people in the Sudan. The international community must support healthcare services in Sudan. This support should include the provision of medical supplies and equipment, and must include protection of civilians and to ensure safe corridor for patient and doctor. The international community also must support efforts to bring an end to this conflict. Finally, we emphasize the urgent need for the international community to support humanitarian aid, safe corridor, healthcare services, protection of hospital and medical care, protection of civilian support for peace building and advocacy and diplomacy. Thank you so much.
Situation, the main difficulty to reach any kind of facility or the service or health services will be in middle of the battle square in Khartoum and West Darfur, and for some extent some area on Central Darfur, because of the huge damage has been done to the infrastructure of the health facilities itself and the health services and the supplies, like what's happened in South Darfur. South Darfur, they lost all the warehouses and their supplies, and it turned down. I can give you some summary about the main challenge now. The main challenge will be the IDPs, and the IDPs numbers. Even we can count the IDPs who's in camp. We think that the majority was punished within the community in Jazeera and in either North Kordofan, West Kordofan, East Kordofan, and Northern State, River Nile. Most of the IDPs have been finished over there. For example, in Jazeera, the number of IDPs in camps are around a figure around 4,000, something like this. But we are estimating that actually we have between 1,300,000 to 2 million actually vanished within the community. It's supporting for a while, but that will make a burden on the community itself with non socio-economic factor and status. Most of Sudanese actually has been under this is by a hand. For example, in Jazeera, the recorded number of IDPs are 4,677, 523 under 5 years old. We have a real challenge with some with vaccine. Definitely, the other chronic diseases, for example, the renal dialysis, providing the services for them. We could manage the staff, we could manage the machines, we could manage the location, but the supplies, the consumable, this really a big challenge. Another thing, for example, the diabetes patients running out of insulin in some states, and we are out of the pathway, safe pathway to reach them. The major challenge for any humanitarian intervention now is finding a safe pathway for both cadres, medical cadres or medical cadres, and the patient themselves to reach the facility, to get service, to provide them the help they need and the care they need. There is a report I will try to share. I'm trying to share it over here. I couldn't share it. I will share it with you on private, and then you can present it over there. Thank you. Appreciate it.
Thank you. Thanks, Dr. Nagut. And now we'll move to our third speaker, Dr. Ahmed Abbas. He came recently with the evacuation from Sudan, so he knows exactly what's happening there and the struggle to leave the country and coming here. Besides speaking on behalf of the preliminary committee for Sudan Doctor Union Trade in Sudan. تفضل دكتور أحمد.
Thank you very much, and hello to everybody, and thank you for coming. I'm going to concentrate on the humanitarian ground, humanitarian situation on the ground as it was documented last night. And this is the view which the Sudan Doctors Union hold. If there is any political questions outside this question, it has to be my personal own views. The situation on the ground remains very grave, and it is deteriorating, unfortunately, by the hour. As most of you or all of you know, that the sixth humanitarian ceasefire announced by the US and the Saudi government during the course of the conflict has never been respected and has never been sadly implemented. And to make things worse, following the signature of the Declaration of Principles in Jeddah, this seems to have encouraged the generals to intensify the war and to escalate their airstrikes and the bombing. Heavy artillery rounds and widespread street fightings are also taking place in almost most of the streets in Khartoum. This is why the Jeddah Declaration has met with some skepticism and disappointment from the general population of the Sudan. This can be explained by people that have high hopes, they have high aspiration, but some of them, they don't understand the Jeddah Declaration is simply a recitation of the international humanitarian law related to the treatment of civilians during wartime. Sadly, the widespread airstrikes and artillery bombing targeted a number of hospitals. We managed to calculate about 17 of them. They have been significantly damaged structurally. The infrastructures has been damaged, and sadly, some inpatients who were in the hospitals have also died, and other innocent passers-by have been injured or died. Beside these 16 hospitals, there are about 7 hospitals which has been raided and occupied by the military, including the two fighting factions. One of them is the National Public Laboratories in Khartoum, which was the eldest institutes of its kind in Africa and in the Middle East. It is very important and very significant in terms of research and in terms of developing some remedies and some treatment for tropical diseases. These laboratories, they contain vaccines, which are going to be spoiled because of lack of electricity. They contain rare specimens of viruses and bacteria, and these, if they are not safely preserved and protected, there is a potential hazard of these areas getting contaminated, and there is the danger of spreading serious endemic diseases, not only within the area, but within the country and the region. The major maternal hospitals in Omdurman, which is the biggest in the country, has been raided and occupied by the rapid support forces, and they're still using it as a base. Some of these hospitals, they're either used as a refuge for the soldiers or used as military bases to launch their attacks. So this will subject these hospitals to further damage and further attacks. 70% of the hospital in Khartoum and its surrounding areas are non-functioning. Put that in terms of figures, that is 60 out of 86 hospitals are not working. And the remaining 25 hospitals are functioning and receiving only emergency cases and doing emergency operations or procedures. These hospitals, again, they frequently run short of electricity and run short of water supply. Only last week, a colleague of ours, who is an obstetrician, was forced to complete an emergency cesarean section under the light of the flashes of the mobile phones. So you can imagine how dire the situation is in Sudan. Oxygen, blood, IV fluids, and life-saving medications are also a short supply and are running out. I'm glad to know that there are recent efforts are being made to open more hospitals in Khartoum and in the country, but these are yet to materialize. In Khartoum alone, there are about 1,200 registered individuals suffering from chronic kidney diseases and kidney failure. And these individuals, they require dialysis 2 or 3 times a week. But unfortunately, the dialysis centers are also lacking the necessary chemicals, solution, and medication to carry out these life-saving procedures. Voluntary doctors working at the functioning hospitals are working round the clock. They are exhausted, they are drained, they are fatigued, they are depressed, but unfortunately, they cannot be replaced because most of the bridges across the Nile are still barricaded by military factions, and transportation using other routes are also hazardous and dangerous. So this is another human factors facing, aggravating the health situation in the country. 6 ambulances which were carrying out injured individuals or medical supplies have been targeted by the military and shot at a different location, preventing them from reaching their dedicated location and hospitals. The medical staff are working driven by their own initiatives and drive, but they are supported and organized by Sudan Doctors Union. Sadly, there is no collaboration or cooperation with the Ministry of Health. The Ministry of Health blatantly, and I want these people to listen to this, blatantly are refusing to cooperate with the working individuals or the Sudan Doctors Union, which would have made the situation better by coordinating the effort of all those concerned to create safe and conducive environment for their work. So this is another factor which is not adding at least the situation in the country. The death toll up to last night, there were 822 deaths which have been recorded, and near 6,000 individuals which has been severely injured. These are the individuals who managed to reach hospitals or who managed to reach medical centers. And obviously, there are few others who, unfortunately, they could not reach the hospital or the medical centers. So more dead bodies are still littering the streets of Khartoum. Some corpses are decomposing, producing some sickening smells and attracting waves of insects and animals, which in itself is a major humanitarian tragedy and constitutes serious health and environmental hazard. As you may have heard, there are a large amount of assets, infrastructures, and private properties which has been damaged and looted. Some of their owners have been injured, and these atrocities allegedly have been conducted by the RSF soldiers. Tragically, there are some cases of rape, and recently there are about 5 to 7 cases which have been reported, and you can find a report on today's Guardian related to the rape cases. These cases have been documented and have been approved. Besides the ongoing on the health care facilities and the continuing violence, there is now a concerted campaign against the leadership of Sudan Doctors Union. This is taking form of verbal abuse and threat of physical violence, including execution. This campaign has been perpetuated and orchestrated by elements of the Muslim Brotherhood or some doctors who are working within the military government apparatus. Simply, they are trying to undermine the heroic and the dictated work of the doctors and the health and other health professionals. Personally, I was, and I'm not surprised of this individual's attitude, because by doing so, they become an integral jigsaws and an integral parts of the war machineries. Their attitude contravenes the essence of medical ethics and medical practice, and they are a breach of the humanitarian laws. They remind me, sadly, of some of the doctors and medical practitioners who were involved with the Nazi Germany and who committed grave atrocities against humanity and actively contributed to the genocide. So the action against, or the threat against the doctors has to be exposed, has to be condemned, has to be reported to the relevant professional organization, either in Sudan or abroad if they are registered. We are very proud in Sudan Doctors Union to have a similar experience before, when some of the doctors conducted illegal procedures and inhumane procedures. They have been reported to the medical councils and to the Royal College of Surgeons. This happened in 1983, when sadly few doctors participated in performing judicial amputations to individuals. This is why this behavior, this threat against some of the doctors has to be taken seriously, has to be exposed, and has to be reported. I will stop now, and I'm happy to answer them.
Thank you, Dr. Ahmed Abbas. I think we are moving now to Dr. Mayada. Dr. Mayada is a consultant in public health and the president of a special interest group in Public Health College. Dr. Mayada.
Thank you. Can you hear me?
Yes, we can.
Okay, thank you. Thanks. So really, I got few words. What is happening in Sudan is sad and alarming. The healthcare system was struggling before the conflict due to poverty and political unrest. This is why it hit hardest after the conflict started. My plea to UK organizations, communities, and individuals to support the fundraising campaign of the Sudanese Union Doctors. This money is going to be used to alleviate the suffering of patients in the Sudan. This campaign has been endorsed by a number of organizations in the UK, including the Faculty of Public Health. We, as the Sudan Interest Group of the Faculty of Public Health, conducted a quick needs analysis on the current need during this conflict in Sudan, and we have lists of medicines, trauma medicines, and life-saving needs of medicines, and also the need for long-term conditions and the consumables. And my plea to the UK government to start preparing and to send medical aid to Sudan. Also, we have efforts to support the British Sudanese evacuee who came from Sudan. The majority are in the West Midland and London area. There are around 2,000 of them. And my group is the Sudan Interest Group, working with Sudanese British communities and Sudanese Union Doctors, are working to support those communities. So my plea also to the British people, and they are very generous, and they support Ukraine and they support number of world disasters and war, to reach out to the Sudanese Doctors Union and to also support those. Local authorities have provided fantastic. So what I'm asking is British communities to support the Sudanese refugees. As I said, local authorities, they have done really fantastic job in providing the basic support, but those refugees have got lots of children. They will be accessing schools, so it's about the psychological support and the like social support to those children in schools and by wider communities around them. So as I said, we need really to stand together to support the humanitarian action in Sudan. Thank you.
Thank you, Dr. Mayada. So we are trying to get Dr. Haitham, the acting Minister of Health in Sudan, to join the, I think the connection still has an issues. It's got some issues.
First, thank you very much, Bassan, and thank you for your panelists, and thank you for all medical cadre and healthcare workers all over the world, Sudanese diaspora. And we hope peace and security for Sudan soon. And we are very sad for losses in general for Sudanese, and particularly for Sudanese doctors we lost during this war. Really, we all know that this come of a sudden on 15th of April for all the Sudanese, and all the systems collapsing at that time, not only the health system, but fortunately after 3 days, the health system and the emergency operating center at the Federal Minister of Health start to take the lead since the third day and start to bringing all initiatives and all parties in all the states together. Yes, it is not an easy job, and as Dr. Mayada said, already the health system before the war is suffering in health, in providing the health system, health services in a number of the states, suffering in providing the essential services in some part of the countries. The healthcare workers themselves suffering in the term of retention and mobilization in the country. We all know that before the war. And fortunately, after the Minister of Health taking the lead, and usually during such conflicting setting or a war, there should be a national response from the Minister of Health, from all the ministers in the states, from the UN agencies, from the diaspora, from the volunteers, and they should be a commanding for this towards ensuring at least providing essential health services and providing the services for injured people. Unfortunately, through different committees, the Emergency Operating Center and the Supply Committee and a specialized committee for bringing partnership and working with UN agencies and organizations, start to work since the third day of the war. And from Nugud, you have heard the situation in the country so far. Really, the first and second week, most of the states, almost 12 states, has been affected. In particularly Khartoum state and Darfur states, and in particular in Darfur states, the West Darfur states, due to the civil war for 10 days, we all know, and almost the hospital destroyed, the supply system destroyed, and almost the system in West Darfur is collapsing. And the second state is Khartoum state, and we all know that it is the conflict is still going on, and we face difficulties in providing the services. In particularly, some of the hospitals, in particular the central hospitals at the clash area, and some of the hospitals even in some part of Khartoum and Bahri and Durman has been occupied by RSF, and difficult and insecure for the health workers to work. And fortunately in Khartoum, more than, and the number of hospitals is 130, and there is hospitals it could be work. Unfortunately, with the initiatives of some of the medical doctors, with initiative from the volunteers, and with work with the government, some of the hospitals start to work and providing the services at some part of the cities, and also scaling up the services in Jazeera state and River Nile states has contributed much. And we have seen now much of the patients now seeking routine surgeries or services, for example. Now they opt to go to these states, to Jazeera state and to River Nile states and other states as well. Currently, for example, most of the hospitals in Northern state and West Darfur and North Kordofan state now start to work and to be like a second option for most of, because also Khartoum state currently every day we see people go outside Khartoum and actually they are going to seek service outside Khartoum. The second point is related to the supply, and before the war, the availability, the main availability of essential medicines in Sudan is like 60%. And when we say essential medicines, that means the list of like 700 items that essential in the country. That means there is shortage in some medicines and some medicines in the pipeline. And after the war, of course, there is a big shortage will be seen. Fortunately, in Sudan, there is 18 warehouses, supply centers in the states. And most of these states, there is supply already there in some of the states. And in the supply committee, represented by all the directors general of Minister of these states, they are working together, I think, to mobilize resources between these states. This also manage some of the deficiencies in the states, and we have seen this in particularly in renal dialysis, for example, because yes, before the war we have like in country stock like 3 weeks, only 3 weeks or 1 month stock of dialysis in the country, and some of the facilities will go outside the work. And between the states, we managed to mobilize some of of this dialysis set to the states. Unfortunately, now within just last week, we have received 3 months dialysis for all the 104 dialysis centers in the country. And just to remind that also, for example, difficulties in some of the medications like paragraph for renal transplant, for example. Also with partnership and with coordination with some countries, now we have received 1 month, and we are going to receive another 2 months for the transplant patients. And also the medications for the chronic diseases now are facing difficulties, for example, for providing the cancer patients medications. And there is an effort with some of the donors, with some of the countries, friend countries, that in the pipeline. What I would like to say in general, in terms of providing the services, in terms of providing the supplies, there are challenges. For example, the vaccination. We all know that providing essential care, primary health care services is very important. Maternal and child health services. Of a sudden, some of the facilities has been collapsed and stopped from the work. But currently, for example, last week, we are mobilizing the stock of the vaccination for 7 states, from Khartoum to other states, for River Nile yesterday, for Jazeera today, and for other states. I would like to acknowledge, really, I would like to acknowledge the role of the staff at Federal Minister of Health, the role of the healthcare workers at the front line, working 5 days, 6 days, 7 days at the hospitals. I would like to acknowledge the role of the drivers of the ambulances working in difficult situations. I would like to acknowledge the role of the healthcare workers, of the volunteers working in the hospitals. Really, in this situation, through the leading of the Minister of Health and working of everyone contributing from his or her side, inside the country or from outside the country as well. We have received from in addition to UN agencies, international organization, other countries, in particular Arab countries, and also from diaspora, in medical doctors in America, medical doctors in Iran, in the UK, in Qatar, in Australia. All of these are contributing and have a number of initiatives, actually, not one initiative, contributing in Khartoum, contributing in the States. And really, this reflects the real role of having all people contributing together, working together to save the people of Sudan. Just my message, I would like to say that through a unity of commanding, one direction to save our people, working together, identifying our needs, identifying our targets, we can save our people of Sudan. And despite these difficulties we have seen, despite the difficulties to provide service, despite the difficulties of having enough supplies inside the country. But I would like to say that within the last 2 weeks, the amount of supplies, the amount of medications we have just received or in the pipeline from other countries, I think it will fill the gap up to the 60 or 70% of before the war. And also what we have did this time, since the early days, we have identified our needs very clearly, and we have communicating the list of our needs in medications, in supplies, in drugs, in everything. We communicated very clear with the country, with the donor. This is what we need. This is what is our gap in the supply. Unfortunately, most of the supplies and the donation now is coming according to that. And the best example of that for the renal dialysis and for the transplant patient, and really the supply is not an easy part. For example, just the renal dialysis, and that need like $1 million per month for the Sudanese patient, for 88,000 for dialysis and 3,000 for transplant patient. Not less than $1.5 million per month. This is not an easy. This need much work, strong partnership and collaborations with strong donors, with strong partners, I think to fill this gap. I do acknowledge the role of everyone, and thank you very much, Dr. Ghassan. And just I would like to conclude by one thing that ahead in the future, not to forget, in addition to supplies, in addition to provide of essential services, clinical services, primary healthcare services, the issue of public health. Before the war, we all know that the density of mosquito is high, and number of states has dengue fever, and the malaria is a number of the states exceeding the threshold as well. And the wash situation in the country, the garbage and the dead bodies. We expect, fortunately till now, we didn't receive that outbreaks or epidemic in the states. Yes, you have surveillance system, you have reporting from all states, receiving the information, but the situation and the risk is high of having in future outbreaks or epidemics. We are aware of that, and we have identified the number of items and list of things that should be in place. And also we have called Sudanese public health specialists, particularly working with WHO and working in the region, that to work with the Minister of Health to support the surveillance program and also to prepare for containing and preventing epidemic and outbreaks in the near future. Thank you very much, and I'm very sorry for taking a long time. And I would like to acknowledge your role and your participation. And just to conclude by saying that Federal Minister of Health as sitting in the driving seat for this national response, and looking forward to build the health system after the end of this war soon, inshallah. We are ready for everyone letting hand to save the people of Sudan. We are ready to coordinate. We are ready to having room for any initiative that would like to support the health system of Sudan. Thank you very much.
Thank you, Dr. Haitham, and thank you to all our speakers. I think now the floor is open for questions.
Inam Abdelhadi, consultant radiologist. My question is to Dr. Haitham. To our knowledge, the destruction of the hospital is mainly by the Sudanese army. As the Minister of Health, are you notified before they bombard the hospitals to evacuate the patients and the staff? Second question, a very senior doctor in the military is threatening doctors by name for treating injured patients. Has this been addressed?
Hi, everyone. Thank you. My name is Ammar, one of the doctors working here in the NHS. Just a logistical kind of questions for all the panel, like how is it safe for the doctors and the staff in the hospitals to get in and out from home to their working place? And is it true that some of the doctors or the working staff are being held or kidnapped or something to treat the injured kind of people in the armed forces? And the other thing, just logistically about getting the medications to the patients, how are they getting that? How is that being delivered? Even if it is delivered, how are the people actually getting it? And thank you.
طيب سوسن صالح والسؤال برضو للدكتور هيثم. Could you tell us about the situation of الإمدادات الطبية? What's happening in with the الإمدادات الطبية? Medical supply, thank you.
Medication and the medical supply change is very difficult to reach. On the ground, we managed to coordinate with some of the NGO organizations which are working on the ground to deliver some of the needed medical supplies to specific hospitals using their own way of transportation. But still, there is some problems, there are some difficulties, there are some genuine obstacles for that. One of the things which we called upon the warring faction is to provide safe corridors for the medical staff and for the medical supply to reach the hospital and the medical centers, but unfortunately, this has not been responded positively or respected by the warring faction. Regarding your question in to the Minister of Health, my own information and my own perception, there was no warning at all from either warring faction. These were arbitrary airstrike, either missing their targets or targeting the hospitals. Yesterday, the Sherganil hospital was targeted by an airstrike. It was badly damaged. The interior infrastructure of the hospital has been ruined. Some of the inpatients has been died. Some of the staff have been injured, and still we don't have a reliable number about the injured individuals. But sadly, there were no warning at all to these areas.
Thank you very much. First, I would like to say that it is a war, and we expect that the damage to affect the health system at the rest of the country and the rest of the institutes. And from the first day, we have communicated with the leaders in both sides. We send our messages, and we have communication that to avoid the hospitals, because it is the site where the injured people from either from the military, from RSF, from the community. This is the area they will be saved by our medical doctors and staff and the personnel. And I would like to say that the difficulties actually we have seen it is with RSF really, because we have communicated several times with them to avoid occupying the hospitals and being inside the hospitals and using the hospitals as a setting area for them. This is starting from the central hospitals at the beginning, at Shabi hospitals and Khartoum hospitals. And at that time, I was in Khartoum hospitals. I spent one day at the Khartoum hospitals in the fourth day. And we have communicated with, but unfortunately, and now more than 25 hospitals either they stay in that hospital for a while or till now outside the services because of that. And due to this, also we have communicated with the military that try to avoid not having clashes with RSF in these areas, and try to save our hospitals, because this is the area not to be taken as part to be an area for clash. Actually, we have our channels and we have communicated with both parties. Until now, we are sending our message to be away out from all the health facilities, not only the hospitals, but also we know that now RSF are requiring the National Medical Supply Fund at the center part of Khartoum now for 10 days. And also we have communicated to be away from this area because most of the supply of Sudan in this area. It is not once, more than once we have communicated with them.
I'm going to repeat my question both in Arabic and English. في سينيور طبيب في السلاح الطبي بيهدد الأطباء بالاسم لأنهم بيعالجوا الجرحى من الجانبين. هل الموضوع ده اتناقش والطبيب ده يعني اديتوه نصيحة أو يعني anyway, I'll say it in English again. There is a very senior doctor in the armed forces who are threatening doctors by name for treating the injured from both sides. Has this been addressed?
Salam, Dr. Haitham, معاك أحمد الليثي. We all know that doctor in Sudan doing great job, and the Sudan Doctor Union in Khartoum also doing great job. What level of engagement and collaboration between Ministry of Health and Sudan Doctor Union? And are you happy with this level of collaboration? Thank you so much.
I think Haitham call dropped again. We have to repeat.
Hello. Assalamu alaikum. I would like to ask about cutting of water supplies and affecting public health. Especially there is an elderly house in Khartoum North. There is according to the news, there is 4 died of thirsty and dehydration. And also there is some children, they couldn't reach water for 4 days. And as you know, this one going for the whole month, especially in Khartoum North. And the other case, which is published in The Guardian, and a well-known, this woman from Rushwan family, which is an elderly woman staying by herself, and she couldn't reach water for 7 days, and she died at the end. So is this being escalated to WHO or any higher organization as a war crimes or cutting water supplies from public?
So we have got some raised hand. We got Hiba. If you can hear us, you can ask your question. We lost, Dr. Haitham is not present for the time being. If you have a question to the other panelists, please go ahead.
Yes, please. I just would like to express my gratitude for giving me the chance to speak to your prestigious panel. And with all the due respect, I have to say that, and there is no polite way of saying it, but I think you had lost the plot to some extent. Doctors had been behind the first lines of army during all wars, and you can have a look at Ukraine, for example. All the doctors in the NHS, they took a sabbatical leave and they went back to their country to defend their own people. There is no privilege for being a doctor to be spared. You cannot ask to be airlifted to a foreign country to work while your country is bleeding. And what had been explained was a very graphic details about a very plain war. This is basically war. And I think you are a very good, intelligent doctors. And you know, a gangrenous leg usually get amputated. You cannot sacrifice the body because you did have a gangrenous leg. No. So if we had a patient that had been suffering, it's not our choice. Yes, but we cannot sacrifice the 40 million. No, that is not the case at all. We do feel for them. We do have our next of kin who had suffered the same, but they would have never give up 1 meter. When they wouldn't be happy if we jeopardize the future of all the coming children of the Sudan. Guys, I think you have to sit down and take lessons about being a patriot. In the South Sudan on 1952, there was a mutiny of the Ananya II. So during that time, the doctors who went during this mutiny was first Dr. Muhammad Al-Mardi Mamoun, Dr. Abd Salam Saleh Isa, Dr. Addabi, and 3 others. They were doctors just like you. But they decide to go over there. What's wrong with you? Why don't you do that straight away? There is no time for playing the victim here. Thank you. This is my questions.
Let's go.
Hello. Thank you. Thank you for this informative meeting. Just I have a question here. I came to know that many of the doctors they work as individuals at their own areas, taking the risk of providing the emergency first aid service, or even helping those who are injured at their own homes, or doing like a portable small clinic where they can save whoever they can. I would like to know what type of support is is given internally, like is the, you know, maybe whenever Mr. Haitham is reconnected again, maybe if you can pass this on. Just I would like to know what sort of you know, coordination and collaboration is done to those individuals, and how can we here in the UK or Ireland or wherever, how can we support them, even, you know, like money wise, if we do fundraising, how can this money reach them? Thank you very much.
Thank you, Manal. We've got Dr. Haitham here, so before his line interrupt again, Dr. Haitham, there were two questions for you. One is from Dr. Inam. She was asking about a specific doctor in military hospital who's pointing fingers to doctors by name and accusing them and asking for punishment because they were treating both sides. So anything, was this raised or discussed?
Yes, greetings. My name is Glenroy Watson. I'm a representative of the Global African Congress UK chapter. It's very sad to hear of human lives being treated the way that they are, bodies decomposing in the streets. And I hope the state and the authorities will make some effort to identify people, because it's so often that people are left dying and not identified. And, you know, it has to be part of our ritual of respect and recognition that there are some effort to identify people and properly ensure that they are known. My question really is about support. We are here speaking about this from an international point of view, and I heard the sister talk about how the generosity of Britain because of its relation with treating Ukrainian and so on. I hope we all realize that's a fallacy. There's a difference between those suffering in Ukraine and those suffering in Sudan. And we mustn't walk blindly into this. But I just wondered, regionally, what help is being provided? South Sudan said that they will be willing to help to break a peace deal. They were nominated by Uganda, Egypt. Are any of these countries making the medical sacrifice that is being asked internationally? Because if it's available in Egypt, it must be easier to get it to Sudan than from the UK. And the other thing to say is that those flights that were being flown to evacuate international people in Sudan, I was surprised to find there's so many people, so many international working in Sudan. But did they bring any supplies on those planes, or were they just flown out empty when there was a known emergency taking place? So, you know, I just want to know if anybody knows whether they just arrived empty to take back their nationality or actually brought any help or supply, if we are to expect them to do so now. Thank you.
Okay, thank you. Thanks. So my first answer to the lady who said, why don't you go and volunteer in Sudan? I totally agree with you, and I thank you for raising this point. There are some doctors now, they are volunteering, but at the borders, mainly the Argin pathway, which is the border between North Sudan and Egypt, okay? And there are efforts by American aides and volunteering doctors as well at the border with Chad. So these are both. There are challenges in terms of transport. For example, British citizens, which the majority of Sudanese doctors here are British citizens, we cannot be transported by American aides, for example, airplanes, because we did ask. We had to be American citizens. So there are some logistics need to be sorted. Secondly, We, as in, we're working in collaboration, number of bodies in the UK. We have the Sudan Knowledge, the Sudanese Medical, the Sudanese Doctors Association, and my group, which is the Sudanese Public Health Group. Sudan Interest Group. We are now planning the stage what is after war, and Sudan Knowledge is planning a conference in terms of repair of the infrastructure with mainly engineering and planning, town planning expertise and rural planning expertise as well. So that is also in the pipeline, but it will start, we will start the planning stage now, and we will start mobilizing fund and support, either technical or professional support, or funding and international support to the stage of what is after war. The last thing I want to mention, unfortunately, war is a bad thing. It is not a good thing at all. But there are going to be collateral damages and collateral victims. So I'm sure this is a hard thing to say, but this is a reality we have to accept. We need to work to minimize any collateral damage, but it is a reality, unfortunately, we have to accept. Thank you.
The first question was from Dr. Inam about a specific doctor in military hospital pointing fingers and accusing doctors and wants punishment as they are treating both sides. I think she means Dr. Tariq Al-Hadi.
I have no idea, really. I have no idea.
The second question is about the collaboration between the Sudan Doctor Union and Ministry of Health, if you are happy with it, and if there are any ways to improve this collaboration.
Okay, thank you very much. I think this is a good question. And from our side, from the introduction, I have just said that it is our role in Ministry of Health to open our heart and hands to have all initiatives and all parties, associations, diaspora, unions inside the country or outside the country. And really to say that doctor unions and associations outside the country, they are start early. Even they have communication with us from SAPA, from SAMA, from Ireland, from Australia, from Qatar. And I have communication with their president and members of them. And even we have discussed with them the contribution in the country, and we have shared with them what we are looking forward to have. Regarding the inside the country, really we have seen some of the activities and initiatives in some of the hospitals, but I didn't have direct call with them and communication with them since 1 week or 10 days back. I have started the communication, and we would like to work together. We would like to make our best from all the efforts, and this is our role. Not just this. This is our role to take all the white army together, to contribute together, to work together. And really, I have a positive response from their side that, okay, let us work together. Let us be part of the committees leading the response in the country, to work together, to have to contribute to this situation together. This is so far what has been done so far. But really, the country, we have seen their work since the beginning of the war, and even before this, during the COVID-19. And really, I do acknowledge the role of all Sudanese doctors, unions, associations inside the country and outside the country.
Thank you, Dr. Haitham. Yes, I agree with you. This is the way to go. We got Dr. Ahmed Abbas here from the preliminary committee as well. And I think it's time to start this discussion. Yeah.
Gulon Roy asked very valid question about the flight and ships going to evacuate diplomat and Western national. I remember 3 weeks ago in this room, I had a meeting with another group, and there is British officials and diplomats. And I mentioned, unfortunately, this short period of ceasefire were not used to provide medical aids or food or supplies. It is only used to evacuate diplomats and Western nationals. This straight answer for your question, Gilroy. Thank you so much for raising this question. And I got a response next day by email. They said they will consider that in the future, and I have the email. But I don't know what they did. Next war, maybe.
There is another question here.
I can add to what Ahmed said, answer the questions. Unfortunately, the immediate and the rushed evacuations of the diplomat and the foreign nationals from Sudan was met with dismay and disappointment from the general Sudanese public, because they felt that they were left alone. I personally appreciate and understand that one of the fundamental roles of embassies is to look after their staff and to look after its national, but to do it in such a rush way, which as it happened in Sudan, for me, and I expressed this opinion in front of other diplomats, was not the appropriate and the right response.
And moreover, people who leave the airplane, some of them refuse to get into the airplane because they don't have British passport. If the father has a British passport and the kids they don't have, they send the kids away and they allow only the person who had been holding British passport. They rectify this in the subsequent flights. And I know many people.
دكتور يسري محمد emergency medicine registrar living here in UK حزب البعث العربي الاشتراكي. My question is for Dr. Haytham. The Ministry of Health in Sudan has a plan in case, God forbid, this war lasted for months. If there is any plan to do a field hospitals outside the conflict region in Khartoum, for example, if we had the safe pathways for aids from UN and WHO and Red Cross and others, if there's a plan to do this, and if there is anything the medical unions outside Sudan can help with that, or all of us can help with that. Thank you.
So we got Dr. Wafa Salim.
Hello, everyone. Wafa Salim, President of University of Khartoum Alumni Association in the United Kingdom and Ireland. First, I would like to thank the Sudan Doctor Union in UK and in America and Australia, because they always organize themselves and respond quickly to emergencies and mobilize, and they really lead with example. We're so proud of your effort. Thank you for that. Providing service in a very difficult circumstances. We appreciate the difficulties, the staff, and your effort. My question is to Dr. Haytham. My worries is about the potential of pandemic because of the bombing of the laboratory where this is a specimen of bacteria has been kept, and the dead bodies in the street. And because of the displaced people and the movement of people around crossing like boundaries, countries and regions, did the Ministry of Health contact the World Health Organization to alert them in those potential and ask for their help to contaminate those potentials? Thank you.
Thank you. And also we have got Dr. Musab.
No, sorry, Hassan. Thank you very much for giving me the opportunity. I just wanted to answer the question for the gentleman about the evacuation plans, but I think Dr. Ahmed Al-Laisi has answered that. Thank you.
I think the first question was about the plan if this war, that's to you, Dr. Haytham, if this war continued, any plans to start field hospitals?
Okay, thank you very much. I think there is no answer why this war will end soon or will continue. And we have discussion together at the steering committee with the EOC and also with the ONM region how to plan in such situations, different areas, ensuring a supply for the health system, diseases, and the public health issues.
I think we lost him again. Okay. We are aware that there are many questions that need answers. However, unfortunately, time passes quickly and we have to leave this lecture theater by 15 to 9. Therefore, I would like to thank all our speakers from within the UK and from Sudan. And also we thank all the attendees and the journalists who attended in person or virtually. And hopefully we'll see you in the coming events to be organized. Thank you everyone and goodbye.